Welcome everyone. Today's topic of discussion is invisible surgical tools. In case of microsurgeries, high level of precision is required. That is known to you. Precision down to micron level is the requirement in case of microsurgeries. Again, in case of robotic surgeries, high level of precision is required. So if there is an obstruction when you are operating, when the surgeons are operating the patient, especially when high level of precision is required, the area of operation is critical. In that case, if there is any visual obstruction, such as tools themselves, the surgical tools themselves, they may act as the visual obstruction. Just if you imagine this, you can see this one, okay? You can see the dial of this wristwatch, but this is not visible to me right now, okay? Why? Because this part of my hand is working or acting as the obstruction, acting as a visual obstruction. The light reflected from this dial is not reaching to my eyes. That's why I am not able to see this wrist, this dial of this wristwatch. That is the reason. So whenever you are seeing something, that means say you are seeing an object, that means from that object light is reaching to your eyes. That's why you can see that object. Or if you talk about an area, so from that area light is reaching to your eyes. That's why you are able to see that area. Otherwise, not. If light emitted from an object does not reach to your eyes, in that case you cannot see the object. Here in this example also, same thing was happening. So requirement is reaching the light from that object. That is the requirement to your eyes or to the eyes of the observer. So in case of, so you can easily guess that in case of precision surgeries, we are right now talking about only surgeries. So in case of precision surgeries, sometimes tools are required to operate the problem, but the case is what? Tools need to be hidden. Tools need to be kept hidden. So now think about a technology known as cloaking technology. Cloaking technology is the technology by which you can hide the area or the object. Name of that technology is cloaking technology, and for that purpose different materials, different technologies are being used. One of those things is metamaterials. By using metamaterials, you can redirect the light. So in that case, what happens from that object? Suppose an object is coated with metamaterials. In that case, from that object, light won't reach to your eyes. Instead, light will start flowing around the object, just like water flows around a rock. Just like water flows around a rock. In that case, light emitted from that object. I am talking about that object which is coated with metamaterials. Metamaterials are engineered materials. Means special technology has been used in this case. So in that case, light emits. Means electromagnetic waves emit from that object, but that does not go straight to the observer eyes. Instead, that bending of the light occurs. Continuous bending of the light occurs, and for that reason, that emitted light flows around the object. In that case, what happens? If for this part of my hand, same thing happens, then what will happen actually? The background of this hand will be visible, will be clearly visible to me. So in case of surgeries, that is the requirement. Tools are there, but behind the tools, what is there? That needs to be seen by the surgeon. Okay, that needs to be viewed by the surgeon. What is behind the tool? So if you coat the tools with metamaterials, in that case, those tools will be invisible. So background of the tools will be clearly visible in that case. Okay, so that is invisible surgical tools. Those are invisible surgical tools. Okay, so this is not science fiction. Now you know that thing. That this is not science fiction, this is actually reality, but at present, invisible surgical tools are not being used practically. Actually, these things are being tested in labs right now, worldwide. Okay, they are, means researchers and scientists are making to, trying to make these things more accurate, more precise, error free. Okay, means many things are still there. Finishing task, you can say, like you can use this phrase, finishing task. That is left. Okay, so scientists are trying to do all these things. Okay, some problems are still existing over there, so they are trying to eliminate those problems. So, for the purpose of elimination of visual obstruction, this technology known as cloaking technology, where bending of the light actually occurs. Physics is what? What is the physics behind this? Bending of light. Okay. So bending of light is possible by the use of metamaterials. Those materials are specially engineered materials. So in the field of medicine, surgery is nothing but the field of medicine. So in the field of medicine, you can see the use of this technology. Okay. Anyway, so this was all about today's video. So this is the end of this video. Thank you for watching this video.